Hi guys, this is Michelle from Virtual Hand Care, and in this video I'm going to share with you my top 3 exercises for trigger thumb. So if you're dealing with trigger thumb, you are having a lot of pain, catching, popping, snapping when you are using your thumb. That can be really difficult to do just about all your daily activities. So there's a few really important tips that I'd like to make sure I share with you before we get into the exercises. First, you really want to make sure that you do get a proper diagnosis from a hand surgeon to make sure that you do actually have trigger thumb, because there are a few diagnoses out there that can mimic trigger thumb, and they would require some different types of treatment. And the other important tip is to make sure you understand which stage of trigger thumb you have, because with trigger finger and with trigger thumb, there's actually 4 stages or 4 grades of this condition. And it's really important to know which stage you are in, because stage 1, stage 2 can heal better because it's not as severe. And obviously as you go into grades 3 and 4, those are a little more severe, to where conservative management of that condition may not be quite as effective. However, I always say it is definitely worth a shot to try. Now, the next tip I want you to understand is that we need to make sure that you are avoiding any kind of clicking, popping, or snapping in your thumb for the next 4 to 6 weeks. This is so important to do, because every time you pop or snap or click or catch, that is contributing to that inflammation in the tendon. And that's really what trigger thumb is the inability to be able to flex the thumb smoothly because there is inflammation. Trigger thumb is technically what's called stenosing tenosynovitis. Basically, it's an inflammation of the synovial fluid around the tendon sheath. And as the tendon pulls down, it's basically too big to get through the pulley system. That's why using splinting or taping techniques can be really effective, because those can help you still be able to use your hand but not let your thumb get stuck. So in order for these exercises to be effective, it is important to make sure that you are not letting any kind of popping or snapping or locking of your thumb in between these exercises. So to do that, I really like the oval 8 for that. The oval 8 fits nicely over your thumb, and it's so small, it really does not get in the way of a lot of your daily activities. It fits like a ring, and you still can do grasping and pinching and pulling without worrying about that thumb locking or getting stuck. So for exercise number 1, you would take your splint off and you're gonna lay your hand flat. And what we're gonna do is we're gonna work on extension of that thumb. So you're gonna grab the tip of the thumb, pull that thumb out as far as you can to really open up this web space here. Now you do want to make sure with this one that you do not hyperextend right in this joint. You want to make sure that there's a nice stretch right in this web space, and you're feeling it all in here. You're not overstretching. This is not an aggressive pull. After you've stretched, what I want you to do is lift that thumb up. And what we're trying to do is activate the opposing muscle group. So this is your extensors, your EPL tendon. Hold that for a couple seconds and then relax back down. And then bring that thumb just to the side of the index finger. Now this sliding into the index finger should not cause you to trigger. If it does, you want to push that back to next to your index finger. Let's do a couple of those together. Ready? So we're stretching out. Then you want to lift up to get a good contraction of the EPL here. Back down and slide. Let's do a couple more. Good. And then you want to repeat that about 10 times, and you want to do that 3 times a day without your splint on. And you want no pain, no triggering, no catching with that. Okay, exercise number 2. Again, you want to make sure the splint is off for this one. This one is more of a passive stretch. So we're going to be in a thumbs up position with this one. And you want to have the fingers slightly relaxed. And you're going to push the tip of the thumb into extension. And we're going to come down into what's called MP flexion. So we're letting the next joint of the thumb lightly bend. Slowly provide just a little bit of IP flexion. Now, your hand and your thumb should be completely relaxed with this one. You should not feel like it's going to catch at all. If you do, you want to make sure that you're relaxing the fingers, because it's with an actual active contraction is what makes that tendon contract down and lock up. But by passively doing it with your other hand, it's not letting that tendon contract enough to go through the pulley. So we're doing a little bit of passive gliding of that tendon, and we're also gently stretching the joint of the thumb so it doesn't get stiff from being immobilized in that little splint or brace or oval 8 ring for 6 weeks. And then hopefully each time you can go a little bit farther and farther into the palm. Now you can also hold it this way, whichever is more comfortable for you. I really like to use my fingers up underneath the thumb just to avoid any kind of possible bending more than what I want to go. And you just hold a few seconds at the end and then come back up. And good. And again, you would want to do about 10 of those without your splint on, and I would do it a couple of times a day, but then put your splint right back on to go on with your day. Okay, so exercise number 3. This one is more of an isometric contraction exercise. So you're going to place your hand on the table, rest it on the table, and you're going to place your thumb in a little bit of what's called abduction here. You want to make sure you have some space in between the thumb and the index finger. And you're going to want to keep that thumb tip very straight. And what you're going to do is you are going to push down the tip of the thumb with resistance against your other fingers. You can do this against fingers. You could also do this maybe against the table if you wanted to. But the point is to make sure that your thumb is as straight as possible and that you are only providing resistance just to the tip of the thumb. You don't want to go too far down to where you start bending. So you're going to provide some resistance, and I would do some light to moderate resistance, whatever feels good for you. Holding a couple of seconds. 1, 2, 3, and relax it. And again, 1, 2, 3, and relax. 1, 2, 3, and relax. 1, 2, 3, and relax. And what you can also do is when you're doing this, you want to go down kind of to that pulley where the tendon gets stuck at, which is right down in this area, right at your oblique pulley, even a little bit lower than that at your what's called your AV pulley. You want to take your other hand and you want to see when you contract. So go ahead and contract, but then put another one of maybe your middle finger down there. And you want to feel a little bit of a contraction happening down along that tendon, right where that pulley is at. So by providing just some resistance to the tip of the thumb, we're trying to get a little bit of a pulley stretch. By stretching out that pulley, that could potentially allow a little more space so that when you do go to actively bend your thumb, there's more space in that pulley and it doesn't get stuck. So you would want to do about a good 10 contractions of these a couple of times a day as well. And now when you're done with all of those exercises, you want to make sure that you put your splint back on, your oval 8 back on, If you're taped, you can do all these exercises with the tape on. It is very important, again, to make sure that you don't have any pain, any locking, snapping, catching with any of these exercises, and you would want to do these exercises and wear the Oval 8 for at least 4 to 6 weeks. Let me know in the comments below if this video helped you. Do please give it a thumbs up. Don't forget to hit that subscribe button below, and don't forget to check out these videos here that YouTube is suggesting for you. Thanks for watching.